Amid our focus on climate change, time now to look at how it is likely to exacerbate the spread of infectious disease as global temperatures and extreme weather events increase. That has been explored by the WISH Climate Change and Communicable Diseases report and this forum panel discussion.
Hello, everybody. It's another welcome from me, Stephen Sacker. I'm in London and I'm delighted to say I am hosting another WISH forum, this one on climate change and communicable diseases. Now, you may earlier have seen me chairing a fantastic discussion on climate change and health. It was a broader discussion of the general challenges being posed to health leaders at every level by climate change. This time around, we're going to be much more specific. We are looking at climate change and communicable disease. Now, in a funny sort of way, despite the reality of a world wrestling with COVID-19, we ought to just spend a moment celebrating the fact that in the last few years, the world as a whole has achieved quite a lot in terms of reducing the impacts of communicable disease in various parts of the world. Of course, COVID-19 and what we're facing right now sometimes makes it hard to remember that. But even in that more positive context that I'm trying to provide, the reality is that climate change does pose a real challenge. Warming temperatures are spreading the reach of certain infectious diseases, and I'm thinking of dengue fever. Also, malaria is exploiting, or malaria is, as a result of warming temperatures in certain parts of the world, becoming more prevalent, and that is a real challenge. We also see the impacts of population migrations as a result of climate change. That too, population movement, making it harder to control some infectious diseases. And of course, we have the extreme weather events and the dislocations caused by them, which again has real impacts on our ability to control communicable diseases. So that is the context in which we are going to have this discussion. I should say, of course, a big thank you to the whole WISH team and to the Qatar Foundation for having me back to stage this discussion. But I also want to give a special thanks to specific partners we have on this forum. So a great deal of thanks to our partners in Qatar's Ministry of Public Health, the Hamad Medical Corporation as well, and the Primary Healthcare Corporation, all important sponsors and supporters of this particular forum. As in the first forum, we have a format here. There is a forum report which has been prepared by a bunch of experts who've been looking at this challenge over the last few months. We're going to hear a presentation on that report in just a moment. But before we do, let me introduce you to all 5 members of my panel. And panel, I can see you all. It's great to see you all on my screen here in London. Please just give me a wave when I introduce you specifically so everybody around the world can get a handle on who is who. So we have on our panel Dr. Abdul Latif Al-Khal, who is Deputy Chief Medical Officer and Director of the Department of Medical Education at Hamad Medical Corporation. Very good to see you, Doctor. Thank you for joining us. We have Professor Jeremy Hess, who is Professor in Emergency Medicine, Environmental and Occupational Health Sciences and Global Health at the University of Washington. Now, Jeremy is one of the co-chairs of this forum. So Jeremy, very, very heavily involved in the production of this report. And his co-chair, please give us a wave, is Professor Rachel Lowe, Associate Professor and Royal Society Dorothy Hodgkin Fellow at the London School of Hygiene and Tropical Medicine. So Rachel, welcome to you. And Rachel, in just a moment, is going to present the outline of this particular report, and I'm looking forward to hearing that. Two more members of our panel, Dr. Michael Ryan, Executive Director of the World Health Organization Health Emergencies Program. Welcome to you. And Ambassador Stephanie Seydoux, Ambassador for Global Health for France, for the French government. So it's great to see you all. Thank you for joining me. The first thing we must do before we begin our discussion is hear from Rachel. But Rachel, even before I introduce your presentation of the key elements of the report, let me just say to everybody watching, this is going to be as interactive as possible. It is a very important subject, so I'm going to lead the debate for a short while after Rachel's introduction, and then we want you to send us your questions, maybe your insights and experiences on the WISH platform, the WISH 2020 platform. So do not be shy. Send us your questions or observations, and I will put them to the panel. But first off, let us hear from the co-chair of this particular forum, Rachel Lowe.
Hi there, I'm Dr. Rachel Lowe, an Associate Professor and Royal Society Dorothy Hodgkin Fellow from the London School of Hygiene and Tropical Medicine. With Professor Jeremy Hess, I have co-chaired this special collection on climate change and communicable diseases. Climate change has been recognised as the greatest health challenge of the 21st century. Climate change is causing the emergence and re-emergence of many infectious diseases of public health importance. And warnings that have been issued over recent decades have been mostly ignored by governments, and climate change is generally low priority for most funders. Climate change impacts infectious diseases in many different ways, through ecosystem changes or through disruption of disease control efforts. We've seen increases in malaria in tropical highlands in Colombia and Ethiopia. We've seen the expansion of arboviral diseases, including dengue and chikungunya, which are extending into more temperate regions, and also an increase in tick-borne diseases and also West Nile virus in Europe. There are many gaps in the evidence base linking climate change to infectious disease. For example, there are parts of the globe experiencing significant shifts in climate, including parts of Africa and the Middle East, which are underrepresented in the evidence base. There is a limited amount of research on the role of interannual variability as opposed to long-term climate change projections related to disease risk. And our understanding of how climate variability impacts diseases with a strong seasonal cycle is understudied, and this is really important for developing early warning systems. We also need to improve our understanding of how extreme weather events such as floods, droughts, and tropical storms impact both the timing and intensity of disease outbreaks and hinder response efforts. Our report outlines 6 strategies to build resilience and mitigate the impacts of climate change on infectious diseases. These include leading by example and reducing the carbon footprint of the health sector, increasing funding for climate and health research, and framing the problem with a transdisciplinary lens to increase our chances of developing the most innovative solutions. Incorporating environmental information, including Earth's observations and seasonal climate forecasts into public health practice, will give us the opportunity to improve decision-making processes. We need to invest in decision support modelling tools and communication strategies with a focus on community engagement. And importantly, we need to build human capacity in data management, integrated surveillance and leadership, with equity, diversity and inclusion at the heart of this endeavour. The COVID-19 pandemic has showed us the consequences of unheeded warnings. Years of inaction on climate and health are likely to result in even more dire consequences. A wait-and-see approach is short-sighted and invites unnecessary risk. The global health community must align with the WHO and IPCC in their calls for action on climate and health. Time is short and options are increasingly limited. Strong action must be taken now. I look forward to welcoming you to our panel discussion at WISH. Thank you.
Well, there you have it. Rachel's opening remarks really do emphasize just how serious an issue this is. In some ways, one could get rather depressed about the impacts that climate change is likely to have on communicable diseases. I want to begin the panel discussion by just getting from the broad brush to very specific. And Michael Ryan, I'm going to start with you. Michael, how much data is there on the degree to which climate change is already exacerbating problems with certain infectious diseases in certain parts of the world? I'd like a little more detail, if possible, if you can provide it. And also, Rachel, interestingly, she said in the course of that presentation that it's clear there are problems, but it's also clear that governments over years have ignored warnings. So I'd like you to give me a sense of how sort of aware and woken up, if I can put it that way, governments and public bodies around the world are to this long-term impact of climate change on infectious disease. Michael, if you can hear me, you need to put your... Yeah, Michael, you need to unmute yourself. There you go.
I'm muted, yeah. For me, it's almost like 10, 18-wheeler trucks heading down different roads to a central point. The climate change, the weather events, population density, movement, inequity, human rights, everything is converging. And in a sense, the infectious diseases, the epidemics are an outcome of those forces, both forces in the environment, forces in socioeconomic development, globalization, and many other things. But the reality, going to your first part of your question, is we are definitely seeing increases in weather-related epidemics. Rachel has laid out many of the issues that are affecting climate. Tends to drive the range of infectious diseases. Weather tends to drive their intensity and their seasonality. And then it's really social factors. We're packing more and more people into peri-urban slums. So even as you said, if dengue is a problem, it's not just a problem of climate, it's a problem of where people are living at risk from those climate-mediated changes. So it's very complex, but the reality is there. We're seeing huge cholera outbreaks, for example, in Mozambique in the aftermath of flooding. Again, seeing even diseases like Rift Valley fever, Ebola, many of the epidemic diseases. In a sense, we're the fire brigade, we're the fire service in what we do. The reality is we're in effect trying to mitigate and control the impacts of these diseases. The conditions that drive these epidemics are often set up years and decades before in the natural environment and in the way we inhabit this planet. Sick nature is going to lead to a lot more sick people, and infectious diseases will be one of the main ways in which that is mediated.
And the second part of my question, Michael, was about the degree to which we know a lot of this is happening. And as you say, we know that these juggernauts are heading down the highway and are going to crash. But are we doing enough to prevent? What are we doing right now?
Well, everyone speaks to the cost of health, the cost of infectious disease control, the cost of climate change. We see it as a cost model. So our very thinking on how we address the problem is wrong, because when you see things as a cost center, it's a drain on revenue, it's a drain on resources. That we have to turn the way we think about this around. This has to become an investment-mediated model. We need to invest in mitigating the impacts of climate change, invest in reducing that change. We need to invest in health systems. And when you start to look at that model, then it's not a trade-off at the moment in COVID is a very good example. We're spending hundreds of times less on the COVID response than we are mitigating its economic impacts. We're struggling to raise money to get vaccines for everyone in the world, yet we're pouring trillions of dollars into income support. So every time we approach this problem, we put health and we put addressing the underlying issues to the back of the bus, and the financial issues come to the fore, the economic issues. And I believe it's the wrong equation. The algebra is completely the wrong way around.
Well, that's a very powerful statement, and the best thing for me to do is put it straight to Stephanie Seydoux, if I may. Stephanie, you're the ambassador for global health for France. Are you getting the balance wrong in terms of the way you look at the challenge of healthcare, but particularly infectious diseases? And do you need to recalibrate the equation when it comes to the assistance and investment you make around the world?
Well, thank you very much for the question and for giving me the opportunity to answer that. Indeed, very powerful comment by Dr. Ryan. Well, we can't say that the international community, and it's not the experience of France in particular, has not been immediate and strong as soon as the COVID outbreak came up. And I think what we've seen are really rather unprecedented levels of collaboration, capacity to actually gather together beyond the, let's say, traditional setup of governments, although it's been a government-led response through the G7, the G20 as well. Very strong leadership by WHO, which is a multilateral organization. And beyond that, also private sector, private foundations, civil society, or trying through, in particular, initiatives such as the Access to COVID Tools Accelerator, rise up to the challenge, which was to really gather as much, indeed, attention, financial support, and capacity to get us to finding the vaccine, the treatment, the diagnosis, and the health system responses that were needed in accelerated time. Now, obviously, if we balance out the amount of financing which is needed for that and what has been gathered so far and compare it to other expenses, which, or rather investments, to take up Dr. Ryan's terminology, which were poured into the also very much needed economic response, yes, there is a gap. However, I believe that the way that that's been approached has indeed been one of an investment model within the ACTA initiative. What's been put forward is an investment case. So I'm not saying we're there yet at all, but and that was really my main point, is that we've had to, in a really accelerated crisis mode, find new ways of addressing the issue of COVID and address it in a way which remained as much as possible coherent with strong commitments to other priorities such as climate, of course, and other SDG-related priorities such as education and gender, for instance, and tackling inequalities. So that's definitely at least been the focus of my government. I'm not saying we are, everything is perfect, not at all, but it's certainly been a concern to act as fast as possible in a collaborative, multilateral, and efficient way, and do so without putting one emergency, the health emergency, at the top of our priorities to the detriment of others. And maybe just to finish on this point, say that there's been a big event last week, the Paris Peace Forum, and the focus was indeed on health, how to escape that issue, and took the opportunity to, I hope, relaunch interest and advocacy to gather enough financing for that response, the one to accelerate access to COVID tools. But the focus was much wider, and indeed was on refocusing as well on the environment, on the necessity to address the climate challenge. And one last word to say that one action which was announced during that event was the launch of the One Health high-level expert panel, so promoting the One Health vision of a multidisciplinary approach to health and environment challenges, and doing so at a level, and the objective of that council is to raise awareness and provide reliable and visible information to, at the same time, well, hopefully advise governments and fight the infodemics, which we've seen, unfortunately, too often at play, pretty much on the model of the International Panel on Climate Change, the IPCC. So a few elements of response. Indeed, this is the time to transform the approach to health into an investment case rather than a cost-driven narrative. I agree.
Yeah, well, I don't think anybody would quarrel with the need for a greater investment focus on this challenge of communicable disease in an era of climate change. Having got sort of a global overview there from Michael and Stephanie, I want to get more local now. Abdul Latif Al-Khal is Director of the Department of Medical Education at Hamad Medical Corporation. So your focus is regional and Qatari, obviously. I just wonder if you can tell me about the linkage you see where you are between climate change and communicable disease. And I'm thinking the region, not just Qatar, but the Gulf and the wider Middle East region. Do you see clear linkage?
Yes, sure. Thank you. We always, thought that given that we are an arid, mostly desert region, that probably will not be affected by climatic change that much. But actually, we are seeing it already. In our region, we are already experiencing the effect of climate change with longer summers, milder winters, floods, and more frequent sandstorms. Here in Qatar, particularly in Doha city, we are highly susceptible to uncertain, chaotic, and extreme weather events as a result of climate change. Cities in Qatar are particularly at risk because of their complexity and dense urban ecosystems. Our country has witnessed a rapid population growth, as you probably know, with rapid urbanization and increasing complexity of its cities. Doha, the capital of Qatar, faces climate change risks as we experienced during the past few years, with unusually intense and frequent rain, followed by flooding, where the streets flood with water. And the population of Qatar grew very quickly from around 670,000 back in 2002 to 2.5 million in 2018. This is a growth of about 245% in just 16 years. The rapid growth is mainly because of influx of people who are coming for work. Many of those come from countries where vector and waterborne diseases are highly endemic. The ongoing industrial development and mega infrastructure projects, which reflect the economic growth in the country, have resulted in a significant pressure on our local ecosystems and consequently increasing our exposure and vulnerability. This is in addition to the fact that we are a coastal country and with coastal cities, which puts us at higher risk for climatic change and increasing sea levels. While some of the climate changes impacts will have a gradual pressure over time, such as the increasing temperature and the average sea levels, the increased likelihood and frequency of extreme weather variations, like the increasing intensity of heat waves and flooding, will require an immediate attention, and this should be a priority. While there are no reported indigenous cases of vector-borne diseases in Qatar in recent years, Qatar falls on the same latitude and as the rest of the region fall in the same latitude where malaria and dengue fever vectors are spreading. Therefore, there is a need for a robust surveillance and preparedness system to address any potential outbreaks, to assess the magnitude of malaria, yellow fever, dengue fever, chikungunya, Rift Valley fever, and West Nile infections that Qatar will be facing in the future. I think we should be investing more in this field. We should be doing more research that's peculiar to the region. I think there should be cross-governmental collaboration in the region because we share common demographics and geography. We need to direct more resources into research, into interdisciplinary training. We need to have more multi-sectoral approach and interdisciplinary approach to research, training, and policy making. We need to build more human capacity. And all of those things were very nicely reflected in the report. Recently, an assessment was done to look for mosquito vectors in Qatar, using morphological and molecular tools in collaboration with WHO and with our academic partners in Qatar, like Qatar University and Weill Cornell. And this provided some initial data, which shows that we mostly have the Culex and Anopheles mosquitoes in Qatar. So far, we don't have the Aedes and Albopictus, but probably it's a matter of time before we see them here. So there is so much that need to be done. Back to you. Thank you.
Yeah, no, that's very interesting. So what you're saying to me is you believe that it is a very real danger that climate change is going to expand the range of some infectious disease into Qatar in a way that Qatar hasn't seen it before. So the question is are preventive measures already being put in place? Is capacity being built to cope with that reality now, as opposed to sort of waiting for it to happen later and then reacting to it?
I think more needs to be done. I don't think we are ready to deal with a spread of the vectors of malaria and dengue and other viruses in Qatar and the region. Those vectors are already there in some of the countries in the region. We are worried that it's a matter of time before it makes it to Qatar. And I think much more needs to be done. I think much more preparation. And the first steps towards this have started, which is surveying the vectors in Qatar and seeing or coming up with a baseline. But there is so much more work now that needs to be done. At this point in Qatar, the region, only insecticides are used, or mainly insecticides are used to control vectors. These can be dangerous and they are not really adequate. So I think there should be more careful planning, there should be programs, initiatives, and there should be a multi-sectoral approach that involves public health, environmental sector, animal sector, agriculture, as well as academia. And I think that countries should not really work alone. They should be working together. So a country like ours should be working with all of its neighbors and maybe beyond that to try to leverage each other's experience and come up with a collective strategy.
All right. Great. Well, Dr. Alkal, that's really interesting. And thank you very much for that perspective from Qatar on the challenges that you expect to come your way as a result of climate change. Now, I've saved Jeremy and Rachel till last in a funny sort of way, because you both have been intimately involved with the writing of this report. So we've had perspectives from the other three. We now want your perspectives. And Jeremy, I'll start with you. In my earlier panel discussion about the broader issue of climate change and health, there was a great deal of focus on the different vulnerabilities of different groups across the world, both within nations and across nations. So I'm thinking of the different vulnerabilities of the poor, whether it be poor nations or poorer people within richer nations, if you see what I mean. And then the differential vulnerability of children, of women, of indigenous peoples, of peoples who have been forced to move because of economic or political circumstance. Can you, as you reflect on your own report, give me a sense of where you see the greatest vulnerabilities as we discuss this issue of climate change and communicable disease?
Thank you for the question and for the opportunity to present our report to the world. The burden of infectious disease globally is principally borne by children and adolescents, but it's distributed across the age, across the population in terms of age. We've been making pretty steady progress over the last 2 decades in reducing the burden of infectious diseases in children in particular. And overall, the burden has gone down, but it's largely because of the inroads we've made with that subgroup, which is very important. However, climate change may threaten that progress going forward. And so I think one of the main groups that we need to continue to be worried about are children and adolescents. But as you said, it's we've got a wide collection of different diseases here under consideration. They all have different dynamics, different ecologies, if you will, and they affect different populations in different locations based on social vulnerabilities, as Dr. Ryan pointed out so eloquently. And so as climate change begins to exert its impacts along with other stresses that we see, globalization, population migration, inequities, poverty, and ecosystem stress, we will see impacts on different populations in different locations as a result. And you listed many of them, and you're hearing already, as Dr. Al-Khal said, stresses on particular groups, locations, cities, areas that are growing rapidly and aren't able to keep up in terms of infrastructure and training for health systems and health personnel. And of course, as you mentioned, indigenous people, which in many locations are being impacted already by substantial environmental change and may not have access to some of the protective structures that are available to other groups. So unfortunately, the answer to your question is it depends. It's a very place-specific and path-dependent question.
Do you think the responses you're seeing from the international community, whether it be state-sponsored or from the big philanthropic organizations who focus on control, limitation, and ultimately aiming for elimination of infectious disease, do you think that they, in their approaches, have a sufficiently nuanced approach to make sense of just what you've said, that actually it's a very complex picture of how climate change can impact the spread of infectious disease? Do they factor that nuance in, do you think?
I would say yes and no. That, in fact, I think there's already an understanding that infectious disease ecology is quite complex, and there are a number of different factors that influence it. I think there is a decided underappreciation of the influence of climate and climate change on infectious disease dynamics. And part of that is born of the complexity of climate change impacts on disease ecology. It can be tough to pull out and discern influences from a whole range of different drivers that are changing all at once. And we noted that in our report that up until recently, probably the protective efforts of the global health system have obscured some of the impacts of climate change. But in recent years, as several other panelists have already already attested to, we are now seeing the impacts of climate change in a more clear way. And I would say the global community has not appreciated these influences in the sense that it really has not invested very heavily in incorporating the information that it needs to discern these things earlier and with more certainty. It certainly hasn't invested in the kind of training that's needed for medical professionals and public health professionals to incorporate and use this information effectively. And it really hasn't invested in some of the tools that climate and health brings to the fore related to forecasting and scenario-based projections of disease burden that really can facilitate management and early intervention and reduce impacts going forward. So I think that thankfully, the underlying stance is we understand these diseases are complex. They have a lot of different drivers. We can build off of that, but to do so, we have to recognize that climate change is ascendant and an important driver that needs to be addressed, and we need to bring the tools that we have in our toolbox to bear on the problem.
All right, thanks, Jeremy. Rachel, I want to sort of build on that answer a little bit. Jeremy just said climate change is in the ascendant. So I want to have you give me a sense of whether you think the real progress that Jeremy just alluded to, that there's been in the last, let's say, 2 or 3 decades in various efforts to reduce the impacts of infectious disease in many parts of the world, whether climate change, in your view, is of such a scale of problem that it threatens to roll back much of the progress that has been made in recent decades, or is that a silly way of looking at it? Try and make sense of it for me.
Well, climate change is very important for destabilizing elimination and elimination efforts. For example, we often see a scenario where we may be close to elimination of, say, malaria in a certain place, and then once that appears to be eliminated, efforts stop. And then you have the combination of warming temperatures, migration. We're seeing a situation in Ecuador, for example, where we're seeing migration from Venezuela combined with warming temperatures, which is extending the transmission season of malaria. And if efforts to control these diseases stop, then we're really at danger of having a big resurgence. So I think that climate change is just one of the very important factors which needs to be understood. It needs to be addressed. We need to be mitigating climate change so that we can prevent seeing such devastating outbreaks of these infectious diseases. And climate change combined with globalization and the increased level of travel that's happening, it's really something that has to be addressed by governments and in collaboration with local communities.
Do you think, picking up on that point, that the potential impacts that climate change can have on the fight against communicable diseases should be used as part of the messaging to get, governments and corporations and others to really engage with the emissions reduction agenda? In other words, is this so important, and does it strike, do you think, such a chord with the public that there should be more messaging about the correlation between climate change and danger of infectious disease spread?
Absolutely. I think climate change should be at the forefront of all public health policy. It's not just an issue of, the melting ice caps. It's really an issue which will, of course, be very dramatic as well in terms of losing coastline. But we need to think about this in a holistic way. All aspects of a warming climate is going to impact our health. So we will see displacements of population. We'll see the expansion of vectors which will allow diseases to be spread. We're going to see an increase in temperature-related mortality, so a combination of both communicable and non-communicable diseases, and all this together can completely destabilize public health services. So really, climate change and these harmful emissions of greenhouse gases needs to be mitigated before it's too late.
Just one slightly counterintuitive question, and anybody can answer this. Rachel, you've got the floor, but anybody else, if they've got a strong feeling about it. Are there any infectious diseases or any parts of the world where climate change actually promises to help the fight against infectious disease? Because, you know, we're being pretty unrelentingly sort of gloomy about the possible impacts of climate change, but are there any places or any diseases where climate change might actually yield some positive impacts?
I think there will be, there will be some areas. For example, you may see less cold snaps and less mortality related to cold weather in certain places, but that's going to be far more outweighed by the areas where, for example, if we're thinking about infectious diseases where temperatures are warming, particularly, for example, in tropical highlands, and if we're exposing communities that previously had no immunity to diseases like malaria, I think that the overall burden will be, negative impacts will be outweighed by any gains.
Thanks, Rachel. All right, panel, we're going to pause just for a moment because we're going to change tack. Obviously, I've been sort of guiding the questions myself thus far, but right now, as I've said from the beginning of this panel, it's time to draw in some of the questions, the observations and insights that have come from you, the audience. So let's get to some questions from all of you watching this panel. Okay, panel. Well, I dare say you're going to get much more searching and intelligent questions now because they're not coming from me, they're coming from the audience. So let's see what we've got. I'm just getting them here on my smartphone from people who are watching around the world. Okay, let's start with the first one. And again, actually, Michael, we haven't heard from you for a bit, so you take this one on. Question, do we have the capability to predict the next pandemic, or pandemics, plural, to enable the global community to either prepare better or to avert them? And that's come from Taufik Ashiru.
Taufik asked a great question. No, we don't. We have some elements of predictive capacity for certain diseases like Rift Valley fever and others. We've had projects of looking at satellite imagery and vegetative indexes, rainfall, and being able to predict some vector-borne diseases. Certainly, cholera epidemics are predictable in only that where cholera is endemic, you will see outbreaks in the aftermath of waterborne events or big weather events. We are working ever more closely. We've set up a global system with many agencies to look at epidemic intelligence from open sources, bringing together all the epidemic surveillance community together. At the moment, we're building another ecosystem called EpiBrain, within which we have a project called EpiCast. And that's really our big problem in predicting real-time predictive analytics is pulling all of that data together. You know, with the current weather system around the world, all of the satellites, all of the buoys around the world of the sea, all of that data is collected and integrated and shared. And then that data is available to scientists to do weather forecasting, to do long-range weather forecasting and climate forecasting. We don't have that same integration on the infectious disease side. So we're working with a whole lot of institutions around the world, academic, the IT sector, building this, what we would call a new ecosystem for both collecting data, developing the artificial intelligence tools to drive the analysis of that data, and making that data available to researchers around the world. One of the biggest barriers for researchers in infectious diseases is not the knowledge of how to manipulate the data, it's actually accessing that data in a way that doesn't cost the earth. So we're trying to solve the three things at the same time, and we'll be reaching out to many people on this webinar and our two colleagues, Jeremy and Rachel, London School and others have been involved in initial discussions. We have to get better at predictive analytics for epidemics. But like weather, the more data you have and the better your analysis, the more accurate your forecast is. And therefore, we need to get much better at doing that. But that's going to require a significant investment. The reason we've invested so much in weather forecasting, because weather drives agriculture, it drives travel, it drives planning, it drives so many core elements of our economy. We've got to see that predicting epidemics and infectious diseases has got to get that same level of attention. And then when we do have that predictive capacity, we have got to prepare both to prevent and to respond to those. It's one thing knowing something is coming. It's another thing being able to do something about it. We have that chance of doing something about it, both from the bottom up side and the top down. Sometimes we're too technological. Our systems are saying, let's make the vaccine, let's find the golden bullet, the silver bullet, and we tend to look for the unicorns that will solve all our problems. A lot of infectious disease preparedness and mitigation is at communities. Dengue can be averted as a major health problem if we give people living in slums the basic resources to clean up breeding sites. It's a community process. We've seen in COVID, countries like Thailand and others have used community-based approaches to really crush this curve of COVID. So I think we have to both look at this as a bottom-up initiative and a top-down. From the top down, we can bring the analytics and the prediction, but we must invest from the bottom up in our communities.
Well, I dare say in a horrible, grim sort of way, COVID-19 has served a purpose in that surely it's focused the minds of governments and other key actors in putting the investment in that you say is required to fully integrate these systems to make the predictive capacity so much stronger. But Jeremy or Rachel, who clearly you do work around this, how long is it going to take, do you think, to get the integration that Michael's just talked about, to truly tap into all the capacities of AI and other data analysis and collection to get this integrated system going? Is it months, years, many years? What is it?
Well, I think, it's a big challenge, and as Michael points out, in the weather community have been doing this for decades and have so much data at their fingertips, and that's a real challenge for infectious disease, being able to collate all that data and have it at your fingertips to be able to make accurate predictions. And it's a very challenging area as well, because when you forecast the weather, a different outcome can mean, a rainfall event could be good news for one user, but bad news for another. But, an infectious disease outbreak is always going to be bad news. So it's going to be a real challenge to figure out how we can, manage an EpiCast project it has many different connotations, and we'll have to think about. There's also ethics involved in collating infectious disease data, and it's going to be a big challenge, but it's absolutely something we have to do to be able to be ready for the next pandemic.
And I would argue that
absolutely,
it's not necessarily it's more than months away, certainly, but it's not decades away. With the right intentions and the right agreements and the right investments, the data is already being collected in many health systems around the world, and it's a matter of addressing the ethical issues and privacy issues and making sure that we can aggregate that data and access it safely. And we've seen, as we've referred to earlier, pretty substantial improvements in global health over the last 2 to 3 decades. And a lot of that is because of very focused, refined, intentional investment in reducing risk factors. And we can do the same here. One thing that I would argue is perhaps a challenge that we didn't fully appreciate until COVID came around is the importance of governance and the importance of protecting perceptions of science. That goes hand in hand with building networks and building analytics and building forecasting capacity. If there isn't strong public faith in science and in governance of these issues, then whatever efforts we assemble are likely to falter. And unfortunately, we've seen that in my country with COVID and some others. And that's a challenge with climate change generally, and certainly something that the global health community is attending to and really needs the help of other sectors to build.
Yeah, but I mean, that's an interesting point, because there are, you know, we know as a result of what we've seen in COVID, there are many people who are skeptical about what scientists tell them about the nature of the disease, and in particular the safety of a vaccine. We know there are substantial numbers of people who are wired to be skeptical, and there are also, frankly, a lot of people who are wired still, it seems, to be skeptical about climate change. So if you put the two together, and you possibly are beginning to see a wall of skepticism, which you guys are going to have to figure out how to overcome.
I think transparency
Anybody
is key,
want to
and
take
I
that
do.
on? Michael, you're looking. Ah, go on, Rachel. Sorry, Rachel.
No,
yeah, go on.
I'm smiling. I'm smiling, Riley, because I think you're exactly right. But I wouldn't like us to walk away from a conversation like this with a sense of despair. We've seen the most incredible. There's 2,051 therapeutic trials for COVID going on around the world. Unprecedented multinational cooperation, and scientists have continued to collaborate regardless of the political differences or the ideologic differences. We've seen hundreds. We've now hundreds of vaccines in various forms of clinical evaluation. There are thousands of scientific papers literally coming out each day on every aspect of how we deal with this and how we move forward from this. We've seen a massive outpouring of solidarity amongst communities. We've seen the greatest acts of kindness. We've seen massive courage by communities and frontline health workers in the face of a devastating disease. I've witnessed that for 25 years. I've seen frontline doctors and nurses, you know, deal with Ebola. I've seen untrained staff have to bury bodies. We've seen people fight malaria. We've seen people in cholera camps treating thousands of cholera cases per day. You know, we've seen local communities take action to protect themselves and protect their communities. I think we need to tap in. We live in a sensitive biome. We're in a biologic dome here in the planet, and it is highly sensitive to everything we do, both positively and negatively. It's not really, in some senses, the corollary of we're screwing up the climate is we can actually, if we change our actions, we can go in the opposite direction in terms of our society, in terms of social justice. So I actually see great hope. I see a massive evidence that we as a civilization can turn this around. And if many of the same behaviors around data and science and preparedness and mitigation are very similar for communicable diseases as they are for climate. And I can see new hope amongst young people. Young people want to disrupt our current systems. Our systems are not delivering for the next generation. And we need a disruptive influence to change that. If disruption without division, divisiveness is what's killing us right now. Disruption is a positive force if it leads to positive change. And we need everyone to be disruptors, politicians, scientists, communities, and we can handle it. And we can handle the infodemics that come with that. I just would like us to make sure that we take a positive view on what we're learning right now and what we can do in the future.
Yeah, very well said. Thank you very much for that, Michael. Here's a question, and we haven't heard from Stephanie, from you for a bit, or Dr. Alcal. So I don't know if either of you could address this, because I'm going to read you the question. You tell me whether you feel you can respond to it. The question is this: despite government statements on their commitment to financial support, the so-called COVAX program is not fully funded. And why is this the case, given the declared priorities of governments around the world? Now, COVAX, I have to admit, this is jargon that is, or an acronym that I'm not familiar with myself, but apparently it's the vaccines pillar of the Access to COVID-19 Tools Accelerator Initiative. Now, I don't know how many of you are familiar with that, but the bottom line to this question is quite simple. Governments around the world say they're utterly committed to funding this COVAX program, but it turns out that it isn't fully funded. So, Stephanie, as you speak on this sort of issue for France, can you explain to me why the gap between rhetoric and reality?
Well, the gap is certainly there, but it's reducing. As I said last week, there was renewed commitment by some governments, including France, and so an additional pledge for over $50 million was announced, and I hope more will come. And when I say I hope, this isn't just simply being wishful. The notion here is that obviously governments have to give more financing beyond the usual development aid, probably. But governments are not the only source, maybe, of financing. A vaccine would benefit the world at large, would benefit, obviously, the private sector. So we have to see how, maybe through innovative finance, we can ensure that we tap into more resource. Also, not to say that the investment case is wrong or anything, but maybe there are other ways to actually reduce the bill. Maybe we can ensure that through mechanisms looking at voluntary licenses, for instance, some of the costs can be reduced. So there's a lot that can be done, and that's indeed what our government wants to keep the conversation very focused on through a charter which has been put forward for this Act Accelerator mechanism, to see how we can indeed really get to the objective, which is equitable access for all these tools, and go through the entire range of actions which are interesting and have potential beyond governments coming up with the entire bill, which is of $35 billion, which, of course, they must rise to their responsibility. And again, many have, particularly Europeans. But there's still a long way to go. And so we really have to keep the mobilization at high level, and envisage all possible paths and alleyways in order to get to that to the target.
Right, but as we look at the news of the first hopeful signs of a vaccine that might be rolled out late this year, early next year, and I'm obviously talking about the Pfizer BioNTech initiative. As we look at that, I wonder if you as a panel are still fearing what was called earlier in the COVID crisis the danger of vaccine nationalism, where governments would frankly bring a sort of nationalist perspective to the race to find a vaccine, and then the distribution of a vaccine. They'd be sort of looking after their own interests, their own people's interests, rather than taking a truly collective, communal, global interest. Is that still a real danger, or do you think that has dissipated?
I want to take this on, but I'm sure Dr. Ryan will have very valuable input to say that I don't think that attitude can be sustainable for responsible governments, and that's certainly the feeling the French government has, that there's no way that we can, or that it is an option for our government to go the way of so-called vaccine nationalism, if that means not caring about everyone accessing the vaccine. Now we look to WHO in this charter that we are proposing for others to join as widely as possible. One of the principles is for the allocation process to be definitely driven by the principles of WHO, and to follow WHO's directives as long as, and it will be the case, capacity and quantities are still reduced as the production capacity gets to full speed. Well, where should the first doses go in terms of where will they be more efficient? And we completely believe that regardless of who pre-bought doses, well, they can keep some for themselves. And after all, Europe is currently very much at risk. It's one of the most affected, or Europe or the United States or some other countries have indeed a very intense pandemic going on right now. But then those doses can also be redistributed to others. And that's certainly a direction which our president said would be an option that France would definitely want to consider. So this is at least the point of view that I can bring forward on this issue.
Yeah, if I could just add,
I'll tell you what, Stephanie, I've just got...
yeah. Oh, sorry.
Yes, I'll tell you what, Michael, I don't want to get too stuck on COVID because I do really want, I've got some good questions here that we should squeeze in before the end of the session, and it very much is about climate change. And
yeah, but 20 seconds, please.
go on, say what you want to say, Michael, then we'll...
Yeah, no, but we want to vaccinate some people in all countries, not all people in some countries, and then we get to all people. That day goes back, actually, Stephanie knows this, to earliest conversations on this were actually between President Macron and with Dr. Tedros way back in April. And France has shown tremendous leadership right through the WAIT process, as has the European Union, Germany and others. So we are seeing tremendous leadership. It's getting everybody to get on board the bus and move this forward quickly. Over.
No, thanks, Michael. That's important. Thank you very much. Okay, I do want to now go back to Qatar, if I may, and Dr. Abdul-Latif. So here's a question for you, because it's very germane to your professional life. How can young medical education advocates fight for the implementation of climate change and health as a sort of correlated set of studies into their respective medical curricula? There's a question from Thomas Petras. So he wants to know if that direct linkage between climate change and health, and in our case of this discussion, communicable diseases, whether that is now being put on the curriculums or curricula of medical schools to ensure that, you know, young medics, young public health people are now taking this very seriously.
Yes, I thank Thomas for his question. I don't think enough is being done to inculcate this kind of those principles into the whether the undergraduate or postgraduate medical education curricula. I think this may be an opportunity to do that. Perhaps this should be taken at a global level, not at a country level, that there should be a call for early education, introducing this concept of climate change and the impact on health into the curricula, changing the attitude very early on among the health practitioners. And this is not only for medical education, but I think that should go beyond that. I think it should be included in public health programs, nursing programs, other health programs, and even in school curricula. I think it's important that community members grow up learning that they are going to live in a more hostile environment in the future with more severe climate conditions. So I think there should be more emphasis including this into the basic curricula for both undergraduate and postgraduate education for physicians and other health practitioners, but also I think should be included in school curricula.
Yeah, good. Well, thanks for that thought. Here's a question, and I'm just going to ask you all to listen to it, and anybody who's prepared to respond to it, raise a hand. It's a bit like an auction. The first person to raise their hand will get the opportunity to answer it. And the question goes like this. I don't know if any of you were able to watch a panel I did earlier, which was the broader panel about climate change and health. David Nabarro, who was chairing the forum on that particular topic, he made a very passionate call for healthcare providers to come together, use their voices to influence policy in a much more direct way than perhaps they've done in the past. He said they shouldn't shy away from what might in the past have been seen as being too political. So the question is, does the panel agree with this when it comes to the communicable disease community? And if you do, how could this message of amplifying voices, how could it actually be made real? So who wants to raise a hand and tackle that? don't all act like your hands have been glued to the chair. Yeah, go on, Jeremy.
Well, I'm happy to set the stage for whoever else would like to contribute. I certainly think that advocacy around this issue is important, which is not to say that we abandon our allegiance to evidence-based practice, but in this case, I think advocacy is evidence-based practice. And we're already seeing this. I think the community has come together through initiatives like the Lancet Countdown, which Rachel and I are a part of, and our engagement with institutions like the IPCC and advocacy at various levels. But I think it could be more strenuous, it could be more coordinated. Our professional societies are taking this issue up and making statements, but it needs to become a more reflexive part of what we do. And one thing I would argue, we mentioned this in our report, and I think it bears mention here, that we need to think about the health sector's carbon footprint, that there's real harm associated with the emissions that come from the health sector. Of course, we do a lot of good, but there are very few analyses that actually look at net good related from or coming from the health sector, because we have substantial emissions. Our emissions are actually larger than the aviation sector. And we shouldn't turn a blind eye to that. We need to clean up our own house. That certainly shouldn't be the only focus of our advocacy work. Our advocacy work needs to be around highlighting the dangers and also all the potential that we have if we work together around these issues. So, but I welcome others' perspectives on this.
Yeah, I think, Stephanie, I may be wrong, but I think your hand was twitching. So do you want to give us your contribution?
Yes, I raised my hand on the panel and not as I should have done like this. No, a very quick one to say, and that's going back to Dr. Ryan's initial very powerful comment about how health ought to be an investment and be presented as such and not as a cost. One aspect of that is giving health workers and care workers in general the right value, their right value in terms of salaries, benefits, place in society, and in many cases that really amounts to actually ensuring that health workers or community health workers, which we've mentioned before as being absolutely key, actually do get paid. And it's unfortunately not the case in all situations. And this is something which, well, I see as definitely as something to be worked on. There ought to be strong commitments towards ending unpaid work in that sector. Also, we know that a lot of these unpaid health or care workers are women. So we ought to be striving to getting this triple benefit of paying health workers correctly and ensuring that they work in right conditions, free from violence, for instance, or free from unnecessary risk. And this yields treble benefits: better health, better equality, and also, well, a better and better economic benefits. So that's one suggestion. Thank you.
Yeah. Yeah, thanks, Stephanie. I've looked at the clock and we're running short of time, so I'm just going to squeeze in one more question. Michael, I'm going to ask you to respond to this one, but I want your pithy, concise response because we're almost out of time. And the question is, it's a very big one and it's an important one to end on, I think. Basically, will the Paris Agreement, that is the climate change accord struck in Paris, and we had Christiana Figueres on earlier, who was instrumental in reaching that accord. The question is, will that Paris Agreement make things better for health and in particular prevention of communicable diseases? It's a kind of simple question. I want a fairly simple answer, and it's from Sophie Albert.
I'll give Sophie a very simple answer. Yes, unquestionably.
Right.
That's as pithy as it gets, Stephen.
That's so short, you've taken me by surprise. Yeah, well, look, I'll tell you what, let's end on the word yes, because so often these panels end with something a bit bleak and depressing. So let us end with that wonderful word yes. And if indeed the Paris Agreement can be followed through on, the message from here is that it will undoubtedly help in the fight against communicable diseases across the world. So let's end with that thought. We are almost out of time. I always like just to have a little bit of a summation at the end, which involves, first of all, thanking my terrific panel. I can still see you all sort of smiling, mostly smiling at me from your various locations. It's been a real pleasure having you with me on this panel. I wish we could have done this in the flesh, because it's always so much easier without all those nasty time delays and what have you. But thank you so much. Jeremy and Rachel, congratulations on getting this forum report out there. It is very important, and I think over the last hour or so, we've managed to get at least a little bit of a flavor of both what's in the report and why it matters so much and how it fits into the wider climate change and health debate. So I thank all five of you so very much for that. I should also just note that the report is part of a wider collection with the BMJ. And if you go to the BMJ's website, go online, you'll find that there is much more material there that is relevant to the discussion we've had today. The only one thing that I will say in final summary is that I thought what Michael and others said about the importance going forward of integration of knowledge, of data, of international bodies, whether they be governmental or non-governmental. The more coordination, collaboration, sharing of data and knowledge that can take place, the more the fight against communicable diseases is going to be a winnable fight across the world. So I wish all five of you the very best of luck in doing what you can to keep that coordination and integration going. But from this particular panel, I'll say a final thanks to all of you for watching and leave it at that. Thank you very much indeed.